I'd like to speak to you now about Ebola, a deadly flight in the night. Ebola is a flaviviridae, of which there are 5 subtypes. Zaire, the one that's known as Thai forest, which usually is in Ivory Coast. Bundibuyo, Sudanese, and then Western USA Virginia strain. Now, 4 of these strains are native to Africa. Now, of course, 1967 was the first outbreak of flaviviridae, which was accounted, or Marburg, which was accounted in an occupational disease from a laboratory worker that was in contact with monkeys that came from the African state via the Philippines. The physicians identified a pattern with repeated cases and isolated the monkeys as the source. Now, they euthanized the animals and quarantined the country from any import of monkeys further. The Ebola virus first emerged in 1976 in Africa when a panic hit the DRC and Sudan, which they developed then a hemorrhagic fever. The Ebola virus was the cause thereof. They sent scientific teams, but by that time the transmission has already ceased and there weren't any further outbreaks. Now, on the data reconstruction from those scientists, they found that the medical closure of the facilities and the quarantine of the villages by the elders actually led to that there would be no further outbreaks, leading to a decrease in the research and international alarm for control of the disease itself. Now, the drivers for the emergence here was basically ecological, where the human demographic and behavioral changes with the change of land use and the changing ecosystems led to the outbreak. Now, outbreaks usually during the dry season is usually where it occurs. Otherwise, they're scarce throughout over the time, but due to an increased overlapping of the factors and the drivers that led to the outbreak of this niche or new to the host. Now, just a quick chronology of Ebola. In 1976, like I said, was the first outbreak. There was 318 cases, of which 280 deaths. The next one was an Ebola in Western Virginia, USA in 1989. Then 1995 was another outbreak within the DRC, of which 315 people got infected and 250 of them died. The largest outbreak, of course, was in 2014, now very recently, which there was 27,000 cases, of which there were more than 11,000 deaths. Now, that's quite significant. So let's just quickly go back to them and cap them. In 1989, Western USA, the epidemiological studies identified the cynomolgus monkey as the source, but there weren't any further outbreaks or back to Africa or political unrest or anything at that point. In 1990, simultaneous further laboratory research diagnosed that the disease's outbreak came from non-human primates, but materials necessary to definitely confirm the utility of these techniques for humans were lacking massively. So they were for the animals, but none for the humans. So in 1994 and 1996, the 5 different types of Ebola was identified via virus isolation, ELISA or PCR. So as technology progressed, they could further identify Ebola. They differed from other flavivirids such as Hanta or Marburg, as the antibodies only developed on recovery of the disease and not during the disease development itself, of which the 2 most common strains are usually Zaire and the Thai forest, which was the Thai forest one, of course, was diagnosed by an ethologist that was studying certain deaths and high mortality rates of chimpanzees on the Ivory Coast. Now, in 1995, an epidemic outbreak in the DRC, Kikwit, had an active disease research was then launched, an investigation during the outbreak, which led to a very high media and tabloid and news elaboration, and luckily the World Health Organization and the journalists used in scientific information, which then led so that the World Health Organization gave a lot of resources and funds and relief to the country. Now, the reservoirs are still unknown, but as of the CDC's website on the 18th of February 2016, the suspicion is all pointing towards bats. Now, just a few quick cycle. As you can see here, basically the bat they're now suspecting as being the reservoir, and then the amplifying hosts being humans, smaller primates or non-primates, as well as then also they've had a case of the duiker. Now, Usually it spreads to the humans. Then the humans with behavioral and cultural aspects leads to a further spread through the humans. Then it can be when they're doing the traveling, and as they travel to the environment and to the cities, that spreads further to those staying within the city bounds, those that then going, of course, to go and see the hospital or the clinics, due to the fact that there's no personal protection, experimentation or places at the medical facilities, that actually leads to a further outbreak. So there was a true scientific paper of its era in 1999 by Peter C.J. and Peter J.W. named An Introduction to Ebola, the Virus and the Disease. And this, I believe, was a true spark for what followed, in my opinion, to the discovery of the bat as the reservoir. The Ebola virus bat was the reservoir host and the animals the amplification hosts. Following the pathogen exposure pyramid, they identified this. So contracting Ebola through direct contact, body fluids, blood, contaminated objects, that was all identified by a further stage. And they also did that bushmeat from an alive or dead animal, antelope, in that area could be the possible contact for the problems. So land use changes was responsible for huge aspects, as they've noticed that it all came from a coal maker that had a plot next to the edge of the forest and the river, which led to a multi-species being investigated. Didn't turn up anything. Multiple research teams launched over multiple sessions, and actually that, together with the paper that was stated, led to the discovery. Now, of course, the next step, I'm quickly going to show you the impact, the negative impacts and some positive impacts that Ebola had during those outbreaks. Now, just a few pictures here at the bottom. As you can see, nice wet summer months, enough foods, enough less overlap from the suspected reservoir host to the hosts itself. And then, of course, during the winter season, when there's less availability, the bats are much higher. So the exposure and the levels of exposure and overlapping of the territories are much greater. Now, if we had travel, this is how quickly and how big it could have traveled and led to a situation where it could have occurred. So the cost of Ebola and the endemic was actually quite significant. There was quite a few negative impacts. Now, the biggest outbreak in 2014 was bigger than all the other Ebola outbreaks combined, and it had 11,000 plus deaths and 28,000 plus reported cases of Ebola. Now, this had a huge economic impact on Guinea, Sierra Leone, and as well as the other spots. Now, the big thing is the economic impact of Ebola was quite. They lost 50% in Sierra Leone of their workforce, which you can imagine it has a huge economical impact. 2.2 billion GDP was lost combined between Guinea, Liberia, and Sierra Leone. Now, if one have a look at the negative impact on the healthcare system, is 881 healthcare workers, doctors, nurses, midwives, all got affected because of not proper protocols being in place for protection. 513 of these died. Now, that is an 8% reduction in the healthcare workforce of Liberia, and 23% decrease in health services delivered to Sierra Leone, which continued led to other problems such as additional deaths due to HIV, tuberculosis, and malaria because that healthcare was not there. Now, taking into consideration the impact that it had on the children, a lot of them lost either one or both parents, 17,000 plus. 33 weeks of education was lost, and also there was a 30% decline in the vaccination. Now, the whole thing cost 3.6 billion rand. Now, luckily, like I said, it was sponsored by the World Health Organization. United States found that they needed to give money, Germany, United Kingdom, and the World Bank, because this disease could have impacted the world and not just that country. Now, the positive outcomes of it was that there was a higher amount of screening at the airports, which led to a situation of better biosecurity in different countries, as also there was increase of 24,000 healthcare workers and better labs now available in Sierra Leone. Now, the management of Ebola, as I've discussed, is in 1976 was due to house confinement by the elders. In concrete, 1996, there was a poor to a more improved standards of medical facilities to help control and stop the spread amongst the health workers dealing with Ebola. But the medical infrastructure was still poor from the beginning, with a suffered greatly from the epidemic. The poor societal infrastructure, transport, helped prevent the massive quick spread of Ebola, and then also the poor media was detrimental in the spread of the information, possibly educating the public to prevent a further spread within certain houses and villages. The hospitals were closed. 30% of the physicians and 10% of the nurses contracted Ebola hemorrhagic fever. It ended with proper patient isolation and supplies that came from the World Health Organization and training that was leading to better biosecurity. So the proper continuous collaboration and planning in the medical logistics aspect was key, and that lasted for about 3 months of containment, which then protected it. Now, there's a vaccination anti-horse Ebola serum, which was protective to a certain extent. Now, out of this outbreak, STRIVE was developed. That is, Sierra Leone trial to introduction a vaccine against Ebola, and which was launched by World Health Organization as well as the local government. These studies suggest that the vaccine may help protect people from getting Ebola, but is yet not known how the protection of the vaccine may be provided. The independent comprised of clinical research experts, statisticians, ethicists, and community representatives. So this was on a local, global, and international level in total, and have been meeting on a regular basis now to review the data as it is collected during certain times. Now, STRIVE's main aim was to strengthen the studies in the existing research and capacity of the institutions in Sierra Leone by providing training. Research experience to hundreds of Sierra Leone staff was in, skills was improved, expertise and trained staff personnel increased, infrastructure expanded, including renovations of the structures and buildings so that there was better ability to enroll for vaccine participants and handling data management and those. So new technology is available to maintain the cold chain, which also keeps the vaccines at required temperatures, which led to a better situation. So this in total had data and safety monitoring on board was very, very crucial. Now, the use of technology, like I said, is such as the media, as illustration, cell phones, which you can have let known, let's see in my village has got Ebola, then also in enlightening the public via images and portraits and pictures, so not everybody could read, but they could understand the situation thereof. Now, the use of surveillance had mainly epidemiological surveillance was very important. The wild animal mortality monitoring network was essential. Now, this was sponsored by the World Wildlife Conservation Society and World Wildlife Fund. Now, animal outbreaks occurred before any human outbreak could have occurred. So this was an indicator that when would it happen before. So blocking transmission at the source of the infectious case is very difficult because there is no way that a primary source or substance could have been identified, i.e. the bush hunting can be removed as a public health intervention for communities whose basis of existence is a substance existence. Nevertheless, the more importantly is the surveillance instruments that has been developed for the survey and carcasses of civilian habitat for Ebola virus itself, identifying those that can possibly lead it. While of limited geographic and temporal implementation, surveillance could be quite useful for the future identification of the Sullivan Ebola foci and the possible interception before human contact could occur. Now, so it is majorly, basically, a warning tool to emerging cases of Ebola. So that's an important part that was different from a lot of the other things that happen. Now, as you can see at the top, they're monitoring the dead animals, biosecurity, and if you have a look, there's actually an animal ethologist working together with the medical field, and the identification could actually be done in the middle in interception before it actually occurs. Now, lessons learned from Ebola is that finding spillover host for Ebola is crucial in controlling and the management. Active collaborative surveillance is very important for a warning and monitoring system as early as possible. Contact tracing of crucial points for control and management. Factors leading to the outbreak still need further investigation. That is all important at this point. So the poor understanding still to what leads to the outbreaks, some species, but nothing collaborative between scientists, needs to be made stronger. So the environmental behavioral correlation to infections to animals, especially in resource scarcity, is important. Now, community engagement, political society willingness, and